It is a pleasure to have you this evening. Debbie, when you're able, if you could share your screen with the PowerPoint, that would be great, but I will talk until then. So I am honored to be presenting alongside of our excellent panelists this evening. I'll briefly introduce each of them. Dr. Deborah Cragun is the director of the genetic counseling program at the University of South Florida and a certified genetic counselor. Dr. Lora Thompson is a clinical psychologist at Moffitt Cancer Center. Dr. Tuya Pal is a clinical geneticist at Vanderbilt-Ingram Cancer Center and the creator of the Inherited Cancer Registry, or ICARE. And then finally, my name is Marleah Dean Kruzel. I'm a communication scientist also at the University of South Florida and BRCA2 previvor. So we're going to start off by briefly discussing communication about inherited cancer risks, and then we're going to move to talking about strategies for coping along that hereditary cancer journey. And then we'll conclude with some resources and opportunities that we think might be helpful in your own journeys. And then we'll move to the second part of our presentation, which is going to be Q&A based on questions that were submitted. And I'll pause right here. Debbie, were we able to get the poll working? Did you want to show that before I move on? Okay, great. Excellent. Thanks so much. Technology helps us out. So as I just mentioned, we're going to be talking a lot about communicating with family members kind of broadly, how to cope with hereditary cancer. So excellent. Dr. Thompson is going to be talking about that. And then we'll also be talking about, I see a high percent for encouraging others to get genetic testing and cancer screening. So we will also discuss that too. So we're so glad. Thanks for sticking with us as we troubleshoot. All right, next slide. So as a BRCA2 previvor and also the daughter of a 26-year breast cancer survivor, I've learned along the way that coping with hereditary cancer is indeed a journey. And when adapting with hereditary cancer, while everyone's journey is a little bit different, it's going to look a little bit different. We've found in research that there are some commonalities that might be helpful for you, as for example, they've been helpful for me. As just one example, in a recent study that was interviewing patients with a variety of different hereditary cancer syndromes, the authors found, as you see on this slide here, that families were an integral part of patients adapting or adjusting to their hereditary cancer syndromes. And specifically, the authors found that family was the main source of not only information, but also emotional support. Now, this might not be too surprising, right? But the authors also found that as families interact and we adapt together, this interaction really influenced each other. It influenced their emotions and their health-related behaviors. So in other words, families' communication about genetic risk information and then their families' reactions to that disclosure really impacted each other, which also then impacted their relationships. And I'm going to explain a little bit more about what I mean by that. Next slide, please. So if the ability for us as patients with hereditary cancer syndromes is significantly connected with patients' families, then we should probably look at, well, how do they function and how do those reactions to genetic risk information impact our own journeys? So here's another very recent study that found both for couples and immediate and extended family members, those people who communicated openly about hereditary cancer had a better long-term adjustment than those who did not talk about it or those who were engaged in emotional distancing. So in short, a key aspect is open communication. Now, in another study, the authors also found that open communication between couples related to less distress for partners of women at risk for breast and ovarian cancer. Now, I do want to pause really quick and note that in neither of these studies is it very clear as to what open communication is, but we can probably surmise from this that it is freely sharing information and discussing without worrying about what might be some ramifications or implications of that information. And I'm going to talk more about this as we go along. Next slide. So this really leads me to three important takeaways that I hope you gain from our time together this evening. Number one is that communication is transactional. It's an iterative process. So what do I mean by this? Communication between individuals, between you and your mom, you and your brother, you and your cousin, all of these is the individuals, we are co-constructing that conversation, and that's going to influence our relationships. So what's essential here is that communication is not linear, right? Meaning that one person talks, one stops, the other person receives that information, processes that information, right, and then responds. No, it happens simultaneously. Yet usually when we think about disclosing genetic risk information, we just think of sharing the information that we have, our specific inherited gene mutation, maybe the associated cancer risks. But it's a bit more complicated than that, and I'm sure you've figured that out since you're on this webinar today. So it's through our communication that we make meaning verbally and non-verbally and create our relationships. So as you see in this visual here, what I want you to take away here is that each interactant or family member, we come to the table, we come to these difficult conversations with our own attitudes, values, beliefs, behaviors, knowledge, experiences, preferences, and that impacts the communication about hereditary cancer risks and ultimately our decisions. Next slide, please. The second important point about communicating with family is that it cannot be a one-time conversation. Sharing genetic risk information is not a one and done conversation. It requires multiple conversations over time. And this is because of a variety of things. Number one, your family members might need some time to process the information that you shared with them. Maybe they were taken off guard. Another thing, sharing information in stages can help reduce information overload, right? Moreover, your family members may react negatively, or maybe they have shown no interest at all when you share the information, and this could be a coping mechanism. And furthermore, sometimes family members even forget that you disclosed information to them. They forget about the inherited cancer risks. We have busy lives. And so it can't just be that one-time conversation. Next slide. And then the third general point here is that effective communication should be evaluated based on the process, not necessarily the outcome. So what do I mean by that? Most people evaluate, myself included in some of my conversations in family, we sometimes evaluate our success in communicating based on how family members react. So if your family member has a negative reaction when you share genetic risk information, it doesn't mean that you failed. Instead, I encourage you to focus on the process of sharing the information. So you see a few questions I've given you here that might help you, right? You can think about, well, did I share accurate information? Did I follow up? Did I actively listen to their concerns? Was I conscious about my own values and beliefs while sharing information? Now, research has found that while family members may report that they didn't initially feel good about the information that's shared about inherited cancer risks, but that usually most people still wanted the information about hereditary cancer. And so by acknowledging and accepting that your family members' behaviors may be out of your control can actually alleviate some guilt and frustration based on their reactions. Now, at the same time, while it's not your job to pressure them, ultimately we can share information in particular ways to help them make decisions when they are ready. And so I'm going to turn it over to my colleague, Dr. Cragun, who's going to take us further.
I wanted to start off by recognizing that some family members have reported that being pressured to make a decision did make it hard for them to adjust to hereditary cancer risk. And I know that many of you don't want to feel like you're being too pushy, which makes sense. So with this in mind, I'm going to talk briefly about some ways you may be able to help motivate family members to take action without feeling like you're nagging. But first, I have another polling question because I want to get your opinions. So let's see if we can make our polling work again. And again, we're going to have about 3 more of these spread throughout. So it would be worthwhile if you can go onto the website or use the QR code. I know someone said that didn't work, but you can also text, join by text, and the information is there. Thank you. I see we do have some participation. This will make it fun. All right, you can continue to get your answers in and join because again, there will be some others, but I'm going to go ahead and see where we are with this and what people are thinking. Okay, you guys are great. All are actually good reasons, though. So I wasn't really trying to trick you, but these are all good reasons and they can motivate people to share information about hereditary cancer. But you've probably thought through that it is possible that your reason may lead to different messages that you're sharing with family members. And it is worth considering the impact of different messages on different people. So we're going to go over a couple things like that, but motivating people to share information in whatever way can be valuable. For some family members, if we share just the risk information and inform them of their risk, that can induce fear. And fear can sometimes cause people to become paralyzed and do nothing, or people might convince themselves that it's not really that big of a deal or that big of a threat. You know, sharks don't usually attack people, so it's fine. So on the other hand, risk information can be motivating for some people. And people are more likely to take action if they believe that taking action is actually going to help reduce the threat. So interestingly, you guys, most of you chose this one, but when people are asked this in surveys, most people actually choose A rather than talking about preventing cancer. Luckily, though, there are often things that people can do to prevent cancer or find it early when treatment's likely to be more successful. And interestingly, some of these things can be getting mammograms, getting breast MRIs, getting colonoscopies. But I wonder if some people are not getting this message. And I also wonder if some people just don't know how effective these can be at preventing cancer or finding cancer early. And so these messages are important to share. So when we did some of our materials, we did try to include these actions that can be done as part of our messaging. And family members have reported that these types of written materials can be helpful, but we always also realize that giving handouts may not be enough, and it's also not personal. So most people do like to talk with a relative and actually communicate verbally, at least initially. When you do communicate verbally, there are certain messaging that you can give that can help motivate other family members to be more protective about their health. And this really brings me to where motivational interviewing strategies can come in. Motivational interviewing is a collaborative way to help people resolve ambivalence and take action. What I mean by ambivalence is that's a feeling of not really knowing what one wants or needs, you know, not really being sure. And ambivalence is really common among all of us, especially in teens and young adults, I have found. Use of MI techniques, when we use them correctly, they don't come across as nagging or lecturing, and they can really support a person's ability to make their own decisions. So I want to talk a little bit about how we can motivate people. As we saw from the responses to my earlier question, other people's motivations can differ from your own. And if people don't realize why something's important to them, they won't take action or make it a priority. So you might need to help them figure out what they really want and why. Motivating someone may also involve helping them decide what actions they're ready to take. If people aren't ready to do something that we think is in their best interest, it doesn't mean they won't ultimately do it, but sometimes if they're not ready, we may need to back off and talk to them again in the future. They just may need some time to process, and they may be dealing with other things that are more important in their life right at that moment. Finally, motivating someone may involve helping them ensure that they have what they need to take action. And that's, again, part of why checking back in to see if they have additional questions can be valuable. Because as Marleah said, I don't know that I would forget big information like this, but lots of people do. So, although motivational interviewing does not really focus on educating, you can give information and you do need to give information. So the way that information is given in motivational interviewing is usually with this ask, tell, ask. What do we mean by that? Well, you ask what they already know or remember, and you listen carefully. And then you can tell them a small amount of information, and you want to make sure that your key, most important points are in that piece of information that you share first. And then you can end this cycle by asking what they think about the information and their desire for more information. And if they don't desire more information at that point in time, that's when you could let them know, okay, I'll check back in at another time and see how you're doing. In motivational interview, you really want to get them talking and you want to show that you're listening. So in MI, we often use these basic communication skills that we sometimes refer to as ORs. The O stands for asking open-ended questions, such as this one here. The A is for providing affirmations that show you appreciate them and value them. And the A is for the R now is for reflections, which are things like you can reflect back their emotions, you can reflect back what they said, and that really shows that you're listening. That as well as summaries, which are a little bit longer, but these are short statements when you're reflecting back. So if you think about it, several people submitted questions about supporting and communicating teens and young adults. I know when dealing with my teen right now, I have to remind myself that I need to get his perspective on things. So oftentimes it's really helpful to start off by asking an open-ended questions like, what are your thoughts? Someone may respond with something like, I should probably be tested, but I'm not sure I want to deal with it now. This shows ambivalence. And you can use ORs to respond to that. Well, there are a lot of possible responses to choose from. I'm going to give a few, and then I want you to be thinking about which one you do, and we're going to do another polling. So here's one of the options. Okay, I know you think you will know. So I really don't know, but I want to know how you think you're going to know when you're ready. The other one could be, I appreciate your honesty and I'm here to support you. And you could do a reflection. Seems like even though you're not ready now, you think testing may be important to you. So that's reflecting back what they said. So here are those responses, and I'm going to give you a second to let us know what you would respond. All right, let's see what people are thinking. Again, there's really no one right answer here. I just wanted to kind of get a sense of what people are thinking here. And it can be helpful. We can never know exactly how people are going to respond, but it can sometimes be helpful to kind of think through what are some of the possible responses. So we have the scenario here. Now I'm going to go ahead and show you the responses. So this one apparently came off as kind of, you know, judgmental or just annoying to the young adult. And as you can see, that open-ended question led to a response where this young woman just shut the conversation down pretty much. All right, what about the next one? Well, the next one, I think with this option, the young individual felt supported, but it actually also shut down the conversation without perhaps intending to shut it down. But at least this individual was not seeming to be annoyed. You just don't really want the conversation to end quite so quickly, and you may be able to keep the conversation going. And again, as I said, the goal of MI is to really get the individual talking and to get them to convince themselves by taking action might be helpful to them. So you may end up wanting to come alongside them and say, now might not be the right time, but I wouldn't stop there because that could end the conversation as well. Perhaps you want to say, it might not be the right time. You know, I'm just curious to know what you think might happen if you wait a little longer before doing whatever the action is. All right, so with our reflection, some of you chose the reflection, and with the reflection, you got a little bit here. You got something here about, yeah, she knows that there's something that can be done if she tests positive to check for cancer. So you could respond in a lot of different ways, but at least this one really kept the conversation going. And you could respond with an affirmation like, you're right, breast MRIs would start for you in a couple of years. And then find out if there are questions and things like that. Notably, although we don't want you to worry about every word you say, this kind of does show that the way you say things can make people react in different ways. And so thinking about that a little bit can be kind of interesting. One of the things that I've learned is that even the order that you say things can make a difference. So remember what this one was. Seems like you're not ready now, but you think testing may be important to you in the future. Something like that. If you turn it around and you say, seems like you think testing may be important in the future, but you're not ready now. What did she lob onto and continue? The last thing you say is often where people will pick up and then start talking. So what we ended up getting here, instead of the talk we got and the openness and the, yeah, there's something I can do to, you know, look for cancer or whatever, here we got something totally different that's called sustained talk, where again, they're kind of just shutting things down. And that's a harder thing to respond to. So if you can think about how you're reflecting things back, that can be helpful because the prior reflection was a little bit easier to respond to and keep the conversation going. But ultimately, if you keep running into resistance while you're using your oars and trying to get the conversation going, then ultimately you really do need to come alongside, because it's not going to do you or them any good to try to argue with them. That's really not motivating, and that's not going to be helpful. And that's okay. You can come alongside them, and then you can say that you'll check in later. You can even ask them, you know, I'd really like to check in with you later to see if anything's changed, or I can help with anything, answer any questions later on. All right, so I have another question for you. What do you think about, could more MI training help you follow up with family members about genetic testing? I know most of you have probably already communicated several times even, because you're here. That means you're engaged, and we know that. But I'm just wondering if this is an approach that, you know, some of this type of training might be something that's helpful to people. All right. So see, ambivalence is common. We have a lot of ambivalence here, and that's okay. All right, so before I move on and turn it over to Lora, I wanted to briefly comment on these other reasons that I listed here. And I know a lot of people didn't choose these reasons, but they are legitimate reasons, and they're not bad. A single family member should not have the burden to share with everyone else in the family, and we all can use some support at various different times. So now I'm going to go ahead and turn it over to Lora, and I'm actually going to stop sharing my screen because Laura's just going to talk to you a little bit and give you a few key pointers. And then again, we're going to have more time for question answer period and discussion.
Great, thank you. Well, it seems like quite a few of you are interested in hearing more about coping. And so I'm going to be speaking from my perspective in working at the Cancer Center clinically with individuals that have been diagnosed with cancer or are at hereditary risk of cancer. So, I didn't do any technology polls. It's beyond my capabilities. So I'm just going to throw out a question though. So I bet if I asked all of you to list good coping strategies, I'm going to hear a variety of different things. Social support, exercise, relaxation, distraction, music, movies, spiritual faith, religious practice, positive thinking, positive self-talk, gratitude, etc. I can go on and on. There are so many different strategies out there that are good. And, some are going to work better for one person than others, and that's normal. But I want to dispel a myth about good coping. And good coping does not mean that you're not going to experience difficult emotions. I think many people strive to cope because they don't want to have those unpleasant emotional experiences like sadness, anxiety, and grief. But that's a normal reaction to challenging events like facing hereditary cancer risk, facing cancer diagnosis, living with uncertainty. So, if we can accept that, right? I think, in my opinion, good coping is accepting that we're going to have the experience of difficult emotions, but you can still find a way to live your life, experience positive emotions, and have other positive experience, right? So those strategies that I mentioned, the support, the relaxation, music, spiritual faith, etc., those are the strategies that help us bring that positive back into our lives, even when we're faced with difficult emotions and difficult experiences. And I want to talk a little bit more about positive thinking, because how we think about things is absolutely important to our emotional well-being. However, if we define positive thinking as only expecting the best results to happen, this is not realistic, right? I mean, the reality is, right, I work at a cancer center. So the reality is the people that I work with face cancer every day, or face cancer risk, or their family members face it. And so if we can redefine how we think about positive thinking, I think that's going to be a better strategy, because if your expectation is to remain positive and always have a good outcome, it's going to be difficult to meet that expectation. So how can we redefine this, right? Because our perception is important. So the way I like to look at this, it's a balance, right? I like to visualize the scales of justice. If you remember, those are the old-fashioned scales, where you can put weights on each side, and one side goes up and one goes down. And a lot of times we're living with some difficult challenges and experiences. And it's not something that we can eliminate, right? If you're at risk, you're at risk. We're not eliminating that. But that doesn't mean that you don't have positive things that you can bring into your life that can balance out those difficult things. So if you can redefine positive thinking to finding ways to have a balanced life, bringing positive back in, and also to think about being positive as being positive or confident in your own ability to cope with life events, right? We kind of, in psychology, we sort of think about this as self-efficacy, right? My ability to cope with something. If we can build on that, I think it can be very helpful. The other point I like to make is that it is also important to recognize when you do need help, right? A lot of times it is hard to reach out and ask for that help. But if you can become aware of that and realize, okay, I'm struggling with being able to implement this kind of strategy or change the way I look at being positive and balancing things in my life, can I reach out to someone for help? And I think this was a question that was posed to me about dealing with what someone called back of the mind worry. So kind of that worry, or sometimes that I think that the rain cloud that's sort of always out there in the sky threatening you, how do you deal with that? And so I think, again, going back to, if you can build confidence in your ability to cope, it helps you deal with that. So I can kind of give you an example. So an example of what kind of worry might somebody have, right? Will I get cancer? Will my child test positive for mutation when they get tested years down the road? Sometimes you can't actually answer those questions in that moment, right? So that's why it's kind of like that cloud, or it's kind of back in your mind, because you don't have the answer. That's living with that uncertainty. But what you can do, kind of going back to that emotional piece, is you can acknowledge that that worry is there, and you can acknowledge how you feel about it. Maybe it's sad, maybe it's scary, whatever that emotion it is. But then what you can do is try to remind yourself of the certainties that you do know, right? So maybe it's bringing it back to, okay, well, what can I do now? Can I gather some information now? Can I start to learn this motivational interviewing strategy to bring to my teen or young adult later on? Can I make some choices for myself in terms of risk reduction? So what can you do now? Sometimes the answer is there's not a lot of changes I can make right now. Maybe I've already done all that I could, and the worry's still there. So then we sort of shift, right? I've done everything I could to address the problem in the future. So the shift becomes, okay, if something like this were to happen to me, what strategies could I use in the future to help me deal with that? Or shift back to, the choice you have is, I'm pretty sure everybody has something very meaningful and important in their life now that they need to focus on and deal with. And sometimes we just have to learn to shift back to that. So, sort of the 3 strategies here, right? Acknowledge your emotion, remind yourself of your coping strategies, what your certainties are, and bring yourself back to the right now. What's important to you right now? What's meaningful? What do you need to focus on? And if you really want to learn more about this kind of skill, I don't know if you're familiar with the term mindfulness, meditation, but there is a good book, mindfulness-based stress reduction workbook, that teaches people how to live in the present moment, how to sort of let go of some of the past thoughts, regrets, future worries, and bring yourself back to the right now. So I think that would be a really good skill to learn. The other thing I want to point out, because as one of the focus here has been on family, communicating with family and talking to them about risk and making decision, is that what applies to adults about emotions also applies to children. They need to be able to experience difficult emotions too, right? And I think there is this idea of protective buffering, right? Like, we want to protect children, and sometimes even spouses and parents, right? We all want to protect others from feeling these bad and, these negative emotions. We don't want to burden them, but that's not real life, right? We all experience them. And sometimes if we don't allow people to experience them, then we're sort of invalidating them. In some ways, they may feel that there's something wrong, that they aren't supposed to feel that way, and they could stuff those emotions and then end up engaging in some strategies that are not so good, right? I mean, we can think about things like, overeating, right? Sometimes we're just feeling terrible, and so now we're, choosing lots of high calorie sweets, things that aren't necessarily healthy for us. Or maybe we become irritable and sort of get into an argument because we're feeling that emotion inside, but we're taking it out on somebody else. So we don't want to invalidate. What we really want to do is, especially excuse me, starting early when children are young, is to be able to help them name those emotions, experience them, and learn how to deal with them, right? So we don't want to allow these emotions to disrupt functioning. Excuse me. So I think of a couple examples, right? This happens. So when I see patients coming into my office, I ask, how'd you get here? What are you here for? And sometimes I'll get the response like, well, I was crying in the doctor's office and they told me I had to come and see you, the psychologist. I guess they think I'm crazy for crying in the office, but they just told me, that I have to get this treatment or I have to make this decision. So, even healthcare providers are sometimes invalidating people. And, I've also heard some of my patients who will say, I'm telling my spouse or my sibling, et cetera, and they just hear back and they tell me everything's going to be okay, right? You're going to be fine. But that's not really the emotion they're feeling. They want to be able to share that emotion. And so I think it's really important that, we don't protect everybody from emotion. We want them to experience them and learn how to deal with it. Now, how do you do that, right? How do you teach others about their feelings? I think sometimes we can do that by modeling it, right? So if you're going to explain to somebody, right, when I received the news about my genetic mutation, I felt sad and worried. I was tearful. It took me a few days, a few weeks to really accept. And at that point, then I started to focus on, oh, what do I need to do? What information I need to get? So you can share how you felt and how you handled it. And what we hope is by sharing that, you're kind of modeling that for others to see, okay, it's okay for them to talk about their feelings. Maybe it's okay for me to talk about my feelings too. In terms of, obviously we have to consider age, right? So the younger children may be a little bit easier to ask, okay, how are you feeling? Or to see how they're feeling, right? If they're crying or something. And then you get to the teens that may be a little bit more difficult. And then sometimes, adults, some don't want to hear, they don't want to hear it, how you're feeling. So sometimes, especially with adult children, you may just have to ask, what is the best way that I can support you with whatever you're dealing with or how you're feeling. If you want me to listen and you want to share, if not, sometimes they don't, right? Sometimes you as an individual maybe don't feel comfortable talking to that person, but you could find somebody else, right? And you can let them know. So if you don't feel comfortable talking to me, perhaps you might want to talk to your brother, sister, father, mother, someone else. So I think I have just a few minutes left, but I wanted to just switch gears a little bit and make a few points about decision making, because I think that's also a challenging task when you're dealing with hereditary cancer. A lot of times, I think people are searching for what a right decision is, which implies that there's a wrong decision, okay? But in my opinion, it's not so simple as right versus wrong. And so again, bringing us back to perceptions that we mentioned earlier, and how we think about things as being important. If we can look at decision making in a different way, that it's not necessarily about right versus wrong in this case of making maybe risk reduction strategies or decisions about communication. I mean, there don't get me wrong, there's clear right and wrong answers. If you ask me if I should speed in a school zone, wrong, don't do it, right? That's clear. But these other decisions, right, it's not so clear. And so if you could look at it differently, that each decision it's kind of like a different path, right? If you take the left path, there's going to be some pros and cons to going in that direction. If you take the right path, it's going to be some different pros and cons from that direction. And so it's not really about, one being right and wrong, but really which path are you more likely to be comfortable on, that you're most likely to be able to live with? Which combination of pros and cons can be best for you. And also remember, last point, that whatever decision you make, it is a lot easier to look back, you know, and feel like I should have known, I should have picked that, I should have known. And Dr. Cragun and I talk about this at the time in her class. You know, that's a bias, right? That's just a human bias that we feel that we should have been able to predict. We can't predict the future. None of us have a crystal ball. The only thing we can do is make our decision based on the information that we have at the time. Okay, so I'll stop there because I know there's maybe some discussion or questions. I'll pass it back.
Thank you so much, Dr. Thompson. I have to say I had a little moment there because your last comment there is exactly what my mother always tells me. You make the best decision you can with the information you had at that time. And so I love that. I really appreciate your perspective. I'm going to let Debbie go back to the PowerPoint. Are we doing the summaries and other resources before we get to the Q&A? So I'm going to turn it over to Dr. Pal. Who's going to share about that, and then we'll get to our Q&A after that.
So I've been monitoring the chat, and I know that a lot of you have been posing some really relevant and important questions. Just to anchor us back, I've been trying to address the medical management stuff in broad strokes, but again, we're looking to you for what is of interest, like what should, like, if this is something that you are interested in us doing. This is our first patient forum, and we all felt pretty strongly that we wanted to do this to see if there was interest. But again, we want to make sure that we are addressing topics that are relevant to the community. So, you know, medical management seems like a really big one. And, you know, my thought is we'll probably do one in future focused on medical management. I've done the best I can with kind of addressing some of the questions, but it's complicated. And the other thing is, hopefully through some of the summary and resources, we'll give you some tools because, you know, at the end of the day, I think this field is moving really quickly. So keeping up, even for us that are completely immersed in the field, is hard. So you as patients, we see, like, we totally understand how it could be very, you know, overwhelming to figure out where to go for information, what are reliable sources, when to find out about when guidelines change, how to figure out, are you, you know, getting, like, how to find the current information about guidelines. So I'll talk through some of that, but again, recognizing it's not, this is not focused on medical management. We'll do the best we can to address the questions. So next slide. The other thing we wanted to kind of talk about, so one of the focuses of this that both Marleah and Debbie went through very eloquently was sharing with family members. And, you know, what we found through our research, again, is sharing with family members, like, I think it has to be a multi-pronged strategy. And as Debbie mentioned, again, what we're finding out, again, through our research, and our research is in the midst of being done, is that sometimes it's almost this, I've shared with family members, what else can I do? And, you know, again, it may be revisiting conversations or, you know, educating family members. The other thing that we found out fairly early in our research is, even though individuals understand their inherited cancer risk, it's not that easy to explain it to family members, because genetics is, as much as genetics is second nature to us, this is what we do for a living, right? So it's not going to be intuitive to individuals in the general population necessarily, unless they happen to have an interest in genetics. So that's where we have been trying to come up with multi-pronged strategies to, you know, pull in family members to see what might be helpful. So this was an effort led by Debbie, where we've created a game, and it's called it. Many of you may be familiar with Life, the game, but it's Life with Hereditary Cancer. And there are, like, it's modeled truly after the game, but using it as a tool to see, well, what is the journey of an individual through the inherited cancer testing, and, you know, finding out you're a carrier or not a carrier or whatever, through the lifespan. So more information to come, but this is something that we are planning to pilot test across individuals with inherited cancer. So again, we would welcome participation to whoever is interested in this. Next slide. The other thing I wanted to mention, and I'll try and go through this pretty quickly, is our inherited cancer registry. And again, this is relevant to some of the questions I've been seeing online. So I'll just go through this in a little bit, or provide a little bit of information. So, you know, we started this more than 10 years ago, actually back when I was in Moffitt and I first met Lora, who, you know, again, you can see has very, very, you know, what's the right word for it? Specific expertise in inherited cancer and psychological implications, which to me is a rare find. But anyways, we started it back in Florida, but when I moved to Vanderbilt, we were able to move the registry to Vanderbilt. The whole concept is partnering with patients and providers to have an interactive relationship, but also to recruit to our registry to move the science forward, but also to push out information. Because we know guidelines are changing. We know that information is coming out. You know, there's a lot of research opportunities. So that's what we do through ICARE. It is a research registry. So it's kind of a list. It's a consented registry. But beyond recruiting individuals into this registry, we also use the registry as a tool to, you know, raise awareness about new research. We do a newsletter every 6 months or so. Can you go to the next slide, Debbie? I know that many of you are already ICARE participants. Can you actually go back? Oh, sorry. Yeah, go forwards. Yeah, I just wanted to acknowledge that there are many of you that are already ICARE participants. And for those of you that might be interested, we'd welcome your participation if you're interested. You can see that there has been worldwide participation, both across patients and providers. Growth, this is already outdated. We're up to about 7,000 participants. And then one more click, Debbie. And then when you see the breakdown, again, it's one of the larger registries in the country, but you can see that's kind of a breakdown of individuals with the various inherited cancer genes. And I want to say we have many, many genes represented, or individuals with many different gene mutations represented in our registry. The here are some of the resources that are available for providers. We host a virtual case conference, but we make the guest expert presentations available on our YouTube channel. So again, for those of you with specific mutations where you want more information, we have international experts that are talking at these case conferences that are taped through YouTube, and available on our YouTube channel. So feel free to peruse that if of interest. I already mentioned we do biannual newsletters. Again, I am the vice chair of the Genetic Familial NCCN guidelines, which we're really the inherited breast, ovarian, and pancreatic cancer guidelines pertinent to genetics reside. So again, we are very intentional about putting updates as they come out. There are really two genetics panels. There's the breast, ovarian, pancreatic genetics panel and the colorectal cancer genetics panel. So we put, as guidelines are released, we'll summarize them. I can't say that we're totally comprehensive because that would take pages and pages, but we give a high level summary. But I would encourage you all to make a free username and password on the NCCN website. I got a lot of questions about, well, what is the right care? And, you know, as patients, you can empower yourselves by going on to this website. It is something that is available to anyone. The only reason they ask you to create a free username and password, which I also have as well, is because they want to track usage, because it is a not-for-profit, but NCCN guidelines are the practice guidelines that guide care in the US and that guide payer coverage as well. So they're an important guideline to be aware of. And when there are updates, again, just periodically checking would be something you could do. So it's nccn.org, and you just create a free username and password, and both genetics guidelines are there. I will also say, you know, we always talk about the inherited breast cancer genes and colon cancer genes, but there are other inherited cancer genes as well. So within the breast, ovarian, pancreatic guidelines, we actually have a table at the back that goes to other genes, other inherited cancer genes, like the kidney cancer genes, or you know, the pheochromocytoma paraganglioma genes, like the SDH gene. So again, there's a lot of information there. And, you know, I would say feel free to reach out to us at ICARE if we can. We know these guidelines are complicated. It would not be a big lift for us to kind of push you in the right direction to find the information that you need in the guidelines. We also have a website that is searchable with information. We have social media. We're active on social media. And again, with the purpose of using a multi-pronged approach. I know everyone receives information in different ways or has different platforms of choice. So even on our social media, we have talks, available newsletters as they are released, open studies. We also do stories, research updates, as well as guideline updates. And our handle is @InheritedCancer. And you can see here the various platforms that we are active on. Next slide. So for ICARE focused efforts, and I think Debbie had kind of gone through with this to an extent, but we are conducting a study of individuals with inherited gene mutations for genes that are in the colorectal cancer or the breast, ovarian, pancreatic genetics familial guidelines. And really the purpose of this trial is to test strategies for guideline adherent cancer risk management, because again, we know that guidelines change. What are strategies that people can use to stay updated and stay adherent to what they're supposed to be doing? The other arm of the trial is strategies to help with family communication. And again, some of the materials that Debbie shared were developed as part of this effort to kind of think through what are some family communication strategies that might be useful. On top of that, just go back for one slide. We're also doing another study in participants in ICARE to look at breast cancers in individuals with inherited forms of breast cancer. And really, the whole concept here is when you have an inherited form of breast cancer, it probably is developing through a specific pathway. We kind of know this for BRCA1 and BRCA2. That's kind of at the foundation of the development of the PARP inhibitors. But again, I think there is a lot more to be discovered, because we know that the pathway to tumor development in individuals with specific genes is has some commonalities. So again, that's something that we are doing through ICARE. So if that again is of interest to you, we are funded to do genomic testing on tumors through this effort. Next slide. And then again, this is kind of explaining that how genomic studies work. You can see that, again, I get asked this question, oh, well, I had breast cancer 8 years ago. Is my tumor sample still saved? And the answer is usually yes. So again, it's paraffin-embedded tumors that we then extract DNA and RNA and then do the genomic. So actually look at the DNA sequence in the tumor. And then you can see here, the pathways to development of these tumors is different across the various different genes. And it's important to understand it because I think this is one of the strategies to develop targeted and personalized treatments for individuals with inherited forms of cancer. Next slide. The other thing I wanted to mention, and again, if anyone's interested, we do have a study that Debbie and I are conducting to streamline genetic education for inherited cancer. And we are also exploring this intervention in the context of family testing, because what we find is sometimes it's hard to get this information. So we're trying to figure out, how do we democratize genetic information so that anyone who wants it can just go onto a website? And again, we have some personnel support on the back end, but it's a much easier way to get an assessment in some ways. I know there are big wait times across clinics, and some people aren't necessarily close to a clinic. So really, it's for individuals who have already had testing or want to get testing. Debbie and I have worked, I don't even know how long now, for the last 8-9 years, maybe longer, on an educational tool that is interactive, that addresses a lot of the information that you would get through a genetic counseling session. And really, it's genetics education. So some of the fundamental information we want you to know. We also ask you to complete some surveys so that we can provide personalized information to you. And here's the there's a link to the survey or the study for anyone who's interested. The other thing that we wanted to also mention, with October being Breast Cancer Awareness Month, we have another patient forum planned, really focused on inherited breast cancers in men. So the date has been set for this, October 29th, again, same time, 6:30 to 8 p.m. Central Time. And we have the founders of his breast cancer awareness, Harvey Singer and Vicki Wolf, who will be our panelists. They are both BRCA2 carriers, and Harvey has had breast cancer. And then my colleague at Vanderbilt, he's actually the director of our cancer center, Dr. Ben Park, who's a medical oncologist focused on male breast cancers. And again, we know that there are a lot of thoughts surrounding male breast cancer and stigma, and, men not necessarily always being as proactive about health as women are when it comes to breast cancer. So again, we're hoping that this will also be on a forum of broad interest to individuals. Next slide. Okay, so now here are some resources, and we tried to be as inclusive as possible, but I'm not going to say that this is everything that's out there, but these are just some of the the organizations that we are familiar with. Force is a tremendous resource, is what I'll say. Like, the information on that website is curated and is monitored closely. So again, for individuals with inherited cancer, I would say Force is a great site to go to for information, for support, etc. Immerman's Angels is another organization which provides one-on-one cancer support within the community for cancer fighters, survivors, previvors, caregivers. So they do have an inherited cancer genetics focus as well. I already mentioned Harvey and Vicki, who were the founders of his Breast Cancer Awareness, which is an advocacy group to inform, educate, and provide support for those impacted by male cancer. And again, it's, some of this was as a result of Harvey's diagnosis and all the issues that he faced as a male breast cancer patient. There's Charcheret, which is a nonprofit organization focused on Jewish women and families living with or at risk for breast or ovarian cancer. And then Alive and Kicking, which is an advocacy organization focused on Lynch syndrome. So again, a lot of great information and a lot of resources available at that website. So these are just some resources that we thought might be useful. The other thing that I will mention, and this has come up in the chat, is for those of you that have not seen a genetics professional where, there may be some nuances to care, findageneticcounselor.com is a way to locate the closest genetic counselor in your area. So I would encourage you to do that, especially for those of you that have, nuances to the genetic testing. The other thing I'll say is we are getting better at risk prediction. And really, when we have, like, the way I think about it is genes, depending on the gene mutation, that gives us information about risk, right? And there are specific, even mutations within genes are not always equal. So we're starting to figure that out more and more. So there may be some nuances to even your mutation. The other thing I'll say is we're getting better at personalizing cancer risk. So there are programs out there where we can take into account hormonal risk factors, as well as lifestyle factors and family history, and give you a more, a more personalized risk. I'm not going to say that these personalized risks are going to be 100% correct, because no model is perfect, but I think it is a useful model. Because even in individuals that I see in my clinic where they have a BRCA1 or BRCA2 mutation, the risk could range from, like, we give pretty broad risks. So when we say all comers 60 to 70% lifetime risk of breast cancer, these models could reduce or raise the risks based on other factors. So, again, that may help with, what you decide to do in terms of future care. The other thing that's come up in the chat is the guidelines. I already mentioned this, but nccn.org, if anyone wants more guidance, we can send out a group email to kind of tell you about how to access these guidelines. But that would be, again, something that in my mind is super critical for individuals to be aware of, to share with your healthcare providers who are probably familiar with this anyways. But again, it's a way of staying updated.
Great. Thank you so much, Dr. Pal. We really appreciate you sharing those resources and updates and the kind of work we're trying to do to help patients. So we're going to move to our last section of this. And so we're going to answer some questions. So I'm going to pose some questions to the three of you, and I might jump in here and there from a patient perspective as well. So these are questions kind of based on what was submitted prior when you registered for this event. So I think we'll go to Dr. Thompson. I'll start with you. You mentioned several different coping strategies that, and I love how you put it, bring us back, bring the positives back to our lives, I think is how you said it. But there were some attendees who submitted some questions about, well, what do I do? What are some specific strategies that are very helpful when you're particularly distressed or you're very overwhelmed, right? So when you just get that cancer diagnosis, or you just find out, about your inherited gene mutation, or someone in the family is diagnosed with cancer, right? These memorable moments. So any specific strategies for when there's extreme emotional distress?
Sure. I mean, there's a lot of different scenarios, right? So I'm going to be very, very sort of general here, but obviously depending on your circumstance, right? If it's you getting the risk information, you getting the diagnosis, being able to have somebody with you, a trusted companion who can help sort of take notes, listen to what's being said, is good, because you're going to feel overwhelmed and it is hard to, do everything that you need to do. And so you're going to give yourself that time. And when to deal with being overwhelmed, it's really about trying to narrow down, what do you need? What is the next step? What do you need to do next? And you can ask yourself a few questions on that. Is there something that's, is there a time limit? Is there something that's due right away and I need that information? So you're trying to really narrow it down to a few simple tasks that you need to do right away, because there's no way that you can complete everything or, answer all questions all at once. So as hard as it is to prioritize, you do need to do that. And sometimes having someone else there with you. can be helpful. So I think that's really about feeling overwhelmed. It's hard to say in terms of distress, because the minute anyone hears the information, hears a diagnosis, the risk, it's those difficult emotions are not, you can't avoid them. So it's giving yourself, maybe permission to feel those, and even telling those around you what you need. Like, I don't need you to say, I'm going to be okay, I'm going to feel better. I just need, you to sit next to me, hold my hand, listen to me tell you how sad, how upset I am, and the time frame on that, it could be days, right? It could be a week. It really kind of depends, what you're experiencing, what the situation is. But I think what you do want to look out for is if you start to notice that these feelings are so overwhelming that, you can't get out of bed, it's been a week, 2 weeks, you can't make that decision, that you might need to, at that point, consider some professional assistance. So that may be if there's a social worker or counselor, somebody at your institution, or, reaching out, on your own through your insurance panel to try to find a professional that you can talk with. Because if that extreme distress is starting to interfere, then you may need counseling, and some people do need medication. So, I think that's really the key, is when it starts to interfere, people start to say things, like, you don't seem to be able to keep up with work, or, the family. So those are some red flags, and you should take some next steps for help.
Thank you so much. I really appreciate that. That's helpful, specific examples, and it kind of gives a frame to work from. I'll move to Dr. Cragun. So another question that we got, and others might be able to chime in here as well. So there are certain groups of family members where it might be particularly difficult to talk about inherited cancer risks. We had a couple people talk about having children who just turned 18. They're emerging adults. They're going off to college. As parents, we're wanting to know whether or not they're going to get genetic counseling and testing. We had a couple attendees talk about young children. I have a 6-year-old and a 3-year-old, right? Like, what do you tell a young child about, treatment that you might be going through, or, prevention, et cetera. And then also teenagers. Dr. Cragun, you had mentioned you're a teenager and ambivalence, so we kind of addressed that a little bit. But these are kind of 3 different groups of people that people had mentioned. So thoughts about strategies for talking to these different types of groups. And I know that's kind of broad, so feel free to take it where you'd like.
Yeah, I'll start with the little ones. I think not overwhelming the little ones with a lot of information is usually good, but definitely not withholding information, because that can be very harmful for kids. When they don't know what's going on, they can come up with all sorts of things in their mind as to what's going on. They may even think that they are responsible for something. So you want to make sure that they know you're there for them, that their needs are going to get met, and also that they can ask you any questions, that you're not going to hide things from them. And it's okay to let kids see that you're sad, because as Lora said, they need to learn how to process emotions. And I think it's okay for them to see, this was hard, but now I'm dealing with it, and talking them through how you're doing that. So I really liked that piece. With teenagers, with most of these hereditary cancer syndromes, thank goodness they don't have to always deal with them as teenagers, because to be honest, most of the screening for a lot of these starts in their 20s, right? So they can have a little bit of time to get acclimated to college. I think starting to talk to them, but again, back off and then try again at another time. And I think little by little might be often the way to do it with kids. little pieces of information here and there and checking in. I'm sure Lora has some other ideas, and Marleah, you might too. I know that you've thought about some of this communication.
Sure, and those were all great ideas. I think, back to the little ones, you can also think about, when you're sharing pieces of information that you can start really basic. There's a lot of good books out there like, oh, what are genes? Or, mom's, dad's going to the hospital and what's going to happen. And so just some basic, you don't have to throw it all out them. You teach them the language, and then you build on that and you can share more information. And I think no matter as you get old, as the kids get older, right? The little ones, they may not be certain. They think something's going on. You need to use the right words and be upfront with them. Reassurance that their routine is going to be in place and there's someone there for them. The older ones, if you don't tell them what's going on, they're going to be searching the internet. So you need to make sure that you are able to share that information before they get misinformation off the internet or peers. And kind of the last thing I would say is, it's okay if you don't have the answers, right? You just have to be honest. I don't have the answer today. I don't know what's going to happen, 5 years down the road. If I do get that information, I'll let you know.
No, that's great. I really appreciate that. Yeah. I mean, I hear from both of you, you're tailoring the conversation right to the child's level of development, cognitive maturity, emotional maturity, behavioral maturity. And I think, from a patient perspective, I think I would encourage all attendees that your children best, right? Like you know your children best. And so as you think about what might make sense for them if they have better conversations, in the car. I was at the FORCE conference. Dr. Pell mentioned the FORCE advocacy organization. We were at the FORCE conference in June, and I heard Dr. Karen Hurley talk about in the car or doing activities, side-to-side communication sometimes works really well for children who are teens or emerging adults, where and even younger children, where they're not having to look directly in your eyes, and it kind of takes the burden off of that conversation. I thought that was really great advice. And then I would say too, I think one of the things that can be helpful just in general, not just in these, difficult conversations, is just to plan and prepare for that, right? Thinking about, where you're going to have this conversation, where the child is comfortable, planning out your location and the time. And if it's too difficult or emotional that day, then putting it on the back burner and, going with, how you're feeling at that time. So I think those are some additional things. I have another question, kind of going off of that, I think, in terms of the emotions. So Dr. Thompson, another question some attendees had was, they talked about how it's difficult to kind of navigate the sharing the genetic risk information, with their children to help them, potentially someday get genetic counseling and testing, should they choose, but also their own emotions, right? The emotions of, have I passed this on to my child? For example, the anxiety, the worry. Any advice do you have with that in terms of that the balancing act? I know my mom and I have talked about it a lot.
Right. I mean, that's a big question, right?
It
There's
is.
a lot of points to that. I mean, I think I can sort of go back to the things I said earlier in terms of coping with worry and anxiety is first figure out, how you can deal with the worries that you have, right? Using that, acknowledging your own emotions, figuring out how you can cope with that, figuring out the things that that you can do right now, right? There's a lot of unanswered questions, and the choice that a person has is to focus on the unknown and the unanswered questions, right? And then that will intensify those emotions, or to try to figure out, okay, I have to make a choice of what I'm going to think about, and let me think about how I can deal with this. As a different option. The other thing, the other component to that, and I don't know if this is part of the question, was how are you dealing with that actual emotional state when you're in the midst of that conversation, right? And that may, as you said, Marleah, to actually plan for that, to think about, okay, what would I do if I start to feel that anxiety or that emotion, when I'm interacting with my child, and what would I say? And so kind of coming up with a plan of what to do in those moments. And of course, as I said before, if it is this level of anxiety and worry is so severe it's interfering with function, then maybe seek some counseling to help you sort of personalize those strategies.
Great, thank you so much. Well, I want to touch on one last thing before we start to wrap up, which was mentioned by several attendees as well. And that was, sometimes it can be difficult to encourage genetic counseling and testing, right, without putting that pressure on family members. And kind of navigating that. So Dr. Cragun, Dr. Pal, any suggestions for our participants today as they, motivational interviewing is kind of a great first step in the direction, but I wanted to give you an opportunity to add anything else.
Yeah, but I also think that encouraging someone to go talk about the testing is indeed a little bit different than, and you can tell them that I'm not telling you you have to get tested, but explain that you feel like this might help them figure things out. And it might be helpful to talk to someone other than you. Because of the emotions, and you can even say, I'm emotionally invested and I'd like you to talk to someone else and let them help you figure out for yourself. So I think supporting that autonomy, giving them that autonomy, and making sure they know that going to genetic counseling is not going to take that decision away from them. It's giving them support for that decision.
Right, right. And almost that next step, as both of you kind of have mentioned several times, right? We've talked about how this is a journey, right? Taking the next step as a manageable way. Yeah. Okay, excellent. Dr. Pell, anything to add there in terms of this idea of encouraging genetic counseling and testing, or talking about genetic counseling and testing without putting pressure? Oh, you're on mute.
Oops. Sometimes I do find, even with my patients, that when people realize, like, kids are a great motivator, right? So even if families will not do it or family members will not do it for themselves, they will often do it for other family members. So emphasizing that I think is also key. Marleah, I don't know if this question was answered, but this is I just found it in the chat, but there was a question about doctors tell you that you're lucky that you have thyroid cancer because it's a good cancer. I felt like there was something wrong with me for being upset. So again, I think that's probably a question for Lora.
But I think that goes back to just feeling invalidated, right? In that anyone, whether it's a family member, friends, healthcare providers, we need to let people experience that emotion and realize that it's okay. So in some ways, I think we need to teach our healthcare providers that it's okay for the people that you work with, your patients, to have some emotions about what they're going through. And it's not necessarily their role to make a judgment about how good or bad something is, right? That we hope they would focus on providing some facts, which is what you do in counseling, right? Percentages and facts and decision making, rather than making a judgment about how somebody feels. So hopefully now, that attendee realizes that it's okay. Those feelings are okay. And, if you feel comfortable, you can share that with the other person, that, I just need you to listen to how I feel.
Thank you so much. And thank you, Dr. Pal, for finding that in the chat. I appreciate that. Well, it is almost time to conclude. We want to thank each of you for joining us this evening. We really appreciate it. We hope that this has been helpful. You've learned a few tips and tricks about communicating with family members and coping along your hereditary cancer journey. We acknowledge that there were lots of questions about medical management, and Dr. Pal, thank you so much for answering those in the Q&A. So it looks like that might be a future patient forum for us. So additionally, if you have time,
And you
we'd
know
love.
what,
Yeah,
Marleah, I would just make one other comment. Like medical
please.
management is broad. So if there are individuals with certain genes, because we're not going to be able to cover, we can cover general principles and I can go through different, you know, specific scenarios in the chats, giving general guidelines, but that's where we can do a medical management forum, but we would like input on how that would be useful, recognizing we cannot cover all of the
Absolutely.
genes, right? So
Yes.
just keep that in mind if you are suggesting medical management, which I do think there's a lot of interest in, but what aspect of that would be useful as someone with inherited cancer predisposition?
Absolutely. Thank you so much for that. So I'll put you know, if you're willing to if you did have one of those Q&A questions, maybe you can put in the chat before you exit out of the webinar this evening, you know, what specifically you're interested in terms of cancer risk management. That would be really helpful so that we can tailor our future webinars to that. And then finally, we would really appreciate it if you would fill out, oh, great, look at this. So what new piece of information did you learn? Some new resources, excellent. That's great. We've got interviewing here, information, guidelines in general, NCCN as being one specific. Good, good. Well, we again really appreciate your time, and we hope that this has been helpful. Again, this webinar has been recorded, so it'll be available for you for the future. And we look forward to seeing you in a future patient forum. Have a great night, everybody.